This is a sensory exam. The first part of the sensory exam is the light touch exam. Oftentimes, a cotton ball is used. You ask the patient to close their eyes, and then you ask them to tell you what foot you are touching with the cotton tip. You touch each foot alternately, and then you can touch both feet to make sure that they can feel both feet at the same time. The next part of the sensory exam is the pinprick. Oftentimes, a safety pin is used. You explain to patients that you are not going to break skin, but you want to be sure they feel the sharpness of the pin. You place the point of the safety pin on their great toe and then on their other great toe and ask them about their sensation. You can also try pinprick sensation on the dorsum of their feet and ask them again about their sensation. The next step of the sensory exam is the vibratory sense. A tuning fork is used. You place the tuning fork on their great toe and ask the patient to let you know if they feel it. If they do, you then ask them to let you know when they no longer feel it, and you tap it 10 times. Okay. And then you do it to the other foot. If they lose the sensation during the tapping exercise, then you can assess how long they feel the vibratory sense for and how severe their deficit may be. The next portion of the sensory exam is temperature sensation, for which you would use the tuning fork again. You simply place the edge of the tuning fork on their dorsum of their feet and ask them if they feel the coolness of the metal. A final portion of the sensory exam is proprioception. You ask the patient to close their eyes, and you're going to let them know that you will move their great toe up or down, and they are supposed to tell you in which direction you have moved it. What's important is that you grab the other remaining toes and move them away from the great toe, as you do not want tactile input to let them know how you're moving the toe.